this webinar with a great joy and immense happiness. I feel privileged to extend my warm welcome to every one of you who present here for the National Webinar Series on the disasters, jointly organized by National Institute of Disaster Management NIDM, Madras School of Social Work Shift 2, and Pegasus Students Forum. After the wonderful session we had the last webinar on the topic of COVID-19 pandemic crisis and opportunity, we are here to learn more in relevance to the ongoing pandemic and its other aspects. Today webinar titled as Concurrent Disaster during COVID-19 pandemic, the lessons learned. I present the ground rules for this webinar topic. Kindly of the participants. Please turn off your camera and microphone during the session for the optimum streaming quality. Post all your questions in the chat box. Questions will be answered as per the convenience of time. Feedback link will be posted in Zoom and YouTube chat box. Please do fill it to record your attendance and your evaluation for the session. Let us start this session. To formally welcome the gathering, I invite Ms. Cynthia from first year MSW to welcome the speaker and the audience. Ms. Cynthia, please take it over.
Thank you, Saravanan. A very good morning to all the dignitaries, guests, and my dear participants gathered today. It's my pleasure to extend a cheerful welcome to you all. Your presence makes us very happy. Life's challenges are not supposed to paralyze you, they're supposed to help you discover who you are. On behalf of the National Institute of Disaster Management NIDM, PG Department of Social Work Shift 2, and Pegasus Student Forum, I delightfully welcome our esteemed Chief Guest of the Day, Sri Ramkumar S. IAS, Joint Secretary of Health and Family Welfare Department, Mission Coordinator at NHM, Government of Meghalaya. We welcome you, sir. I am very honored to welcome Dr. Ajinder Walia from NIDM, our respectful principal, Dr. S. Raja Samuel, our beloved head of the department, Dr. C. Francis, our supportive faculty coordinators, Professor J. Damon Queen and Professor A. Priya Doris from Madras School of Social Work, and other faculty members, welcoming you all. I am sure it is going to be a lively and thought provoking session for all of us. Last but never the least, I welcome our upholders, my dear fellow students, and all the other participants for honoring this session with your presence. Once again, I welcome you all to this national webinar. Hope you all will have a knowledge enriching session ahead. Thank you.
Thank you, Ms. Cynthia. We are happy to have our speaker, Sri Ramkumar IAS, Health and Family Welfare Department, Mission Coordinator in HM, Government of Meghalaya. I welcome Mr. Gautam from first year MSW to introduce the speaker to this audience.
Thank you, Saravanan. Good morning to one and all present here. I extend an earnest welcome to all present in the National Webinar Series 5 conducted by MSSW in collaboration with NIDM and Pegasus Student Forum 2020. I am very honored in introducing the Honorable Chief Guest of this session, Sri Ramkumar Sir, IAS, who is the Joint Secretary of Health and Family Welfare Department, Government of Meghalaya. Sri Ramkumar Sir was the former collector of the Southwest Garu district, and Sri Ramkumar Sir is an inspiring personality. We all know he is the man behind the idea of lighting up empathy in Meghalaya through an innovative project called Million Sol, which stands for Million Solar Study Lamp for Students. Through the Solar Urja Lamp project, many people got job opportunities and were able to develop their skill. Through this innovative idea, Sol project, the people got their employment, and the distribution of these solar lamps were helpful for both the children and their family too. The Soul project initiated by Sri Ramkumar Sir added light to the future generation of empathy. I am glad to tell that he is an alumni of the Madras School of Social Work, and currently Ramkumar Sir is the Mission Director of National Health Mission. Sri Ramkumar Sir is such an inspiring personality. He came up with many innovative projects to give job opportunities to unemployed and to give help to people who are in need of healthcare, and also to develop a self-sustained society. There are a lot more to say about Sri Ramkumar Sir and his innovative ideas and his way of administration. I'm glad to call you, sir, to speak a few words.
Yeah. Thank you, Saravanan. Thank you. I'm sorry I could not get your name, who introduced me with a lot of generous compliments. And thank you, Professor Demin. And I'm happy to say hi virtually to everyone who is there on this call. Shift 2 already, although I studied in the other shift, the day shift. I had a lot of friends from shift 2, and in fact we have done quite a few things in collaboration with things in shift friends in shift 2 also. So it doesn't matter is what I'm trying to say here. And with regard to all the generous introductions and etc., I think they have done some kind of research, because I was not able to give a profile of myself. I mean, I still don't carry a profile or anything of myself. I think might eventually have to do. So I was collectors in 2 districts previously. One was Southwest Garo Hills district, and previously, before that, I was in a collector in a district called William Nagar. So after finishing my 2 stints as collectorship, and but because of COVID times and sudden emergency and health required, and we had done some work in health in my district previously, so I was posted as Joint Secretary in Health and Family Welfare, as well as Mission Director for National Health Mission in Meghalaya since just March 19th. I think the first lockdown was on 22nd or 23rd, if on that Sunday, I guess, if I'm not wrong. So I was posted here on 18th, 19th. I joined here on 25th. Ever since then, I have been with the health department. Health department is not, I mean, since because of COVID, a lot of focus had come on to COVID. But however, it's not basically on COVID only. There are a lot of other matters also which has come during COVID, which is in fact, it's a very important lesson that we had to learn during this COVID times itself. So before going into COVID pandemic and etc., because pandemic is a new kind of a disaster which generally administration is not used to. So if you look into disasters, the generally government administrations are very well equipped to handle with disasters, because there is a separate manpower is there. There's a very well established structure. Thanks to the tsunami in 2004, after National Disaster Management Act came in 2005, after that there is a whole well established structure from top national level till the district level, or even below district level, even each government department level, there are plans and there are trainings, continuously trainings which are going in National Institute of Disaster Management this year. Even as we speak today, in my own department, there is a training going on preparedness for national disaster management, because this is something which we learned during 2004, that disaster was ad hocly managed, and it was not managed in a very scientific, preparation was not there in a scientific manner. So then onwards, there is a district disaster management authority, there is a state disaster management authority, and there is a National Disaster Management Authority. All these things are governed by the National Disaster Management Act, and there are national disaster relief norms, state disaster relief norms are there, and how to manage this, and there are rules established, hierarchy is very clearly established. But however, unfortunately, we did not have a playbook for pandemics, how to deal with pandemics. We never knew, because the last pandemic we dealt was in 1917, 1918. I don't know how many of you know, India had the maximum fatalities during the time. Although it was called Spanish flu, the maximum fatalities had happened across the world. It was in India, because a lot of soldiers after the First World War had returned from Europe carrying the virus, coming to Bombay. From Bombay all the way, many of them were from South. The army, British Army, then the British Indian Army had a lot of armed forces from South and from Punjab, etc. So they took it over everywhere, and there was a huge pandemic. And the pandemic came in waves. Even before people could realize it was a pandemic, that was a lot of because there was not times of communication. People did not know what was happening in the nearby village. I mean, people knew something was happening, but not much of details, and not much of this thing. Not much of communication or clear-cut information of what is happening. However, but pandemic is not new to the world. Ever since 1918 pandemic, there has been the definition of a pandemic itself goes in where you have before when the virus or any kind of zoonotic disease spread beyond a certain limit of countries, it is called a pandemic. The smaller version is called an epidemic, and the bigger versions are called pandemic. Since 1918, there have been a lot of pandemics across the world. Every 7-8 years, we have had a pandemic. That's the shocking reality which many of us are not very aware of. Can I request the host to take off this background? I mean, yeah. I mean, we can have I think all the members can be there on the screen, I guess. So, this kind of pandemic was not new to the world. However, it was not a full-fledged pandemic which had spread across the globe in all continents, in all countries, or maximum number of countries. In fact, the country which is most prepared for pandemic is USA. How? Because they have a very robust Center for Disease Control, and they are one of the highest sponsors for World Health Organizations also, at least until now, where they had sponsored in dealing with preventable diseases, communicable diseases like COVID-19. So the first thing when the learning came was that when George Bush was president, actually, of USA, he had gone on a leave and he had read a book on Spanish flu. That is where he understood something like this could happen, anytime. This was in the year 2002, 2001, if I'm not wrong. When immediately he became president after 1 year, 1.5 years, and he went for leave on Europe for somewhere. He was reading this book and he felt and someone had suggested to read this book. Then he understood that something can catch us by surprise, and these things can go out of control so fast. Particularly during this era where we fly a lot, there's a lot of communication, transportation, etc. People within 12 hours, they can be in any part of the world. These are very, very interesting things. So once he read the book, that is where the word social distancing, wearing masks, all these things were mentioned in that, even creating flu clinics and etc. were all mentioned during in that book. So he comes back to White House and he sets up the Center for Disease Control, kind of strengthens it up. There's a task force and they write an entire playbook. In that, in fact, many of the scientists refer that, more than in temperate countries like USA, Europe, and etc., tropical countries where between Tropic of Cancer and Tropic of Capricorn, where we are located in like countries like India, a lot of African, Southeast Asian countries, he said these are the countries where we need to support them a lot. We need to support them and we need to prepare them for some kind of, because diseases might start from there and it might end up here. And if you don't do the kind of disease control there, then we will not be able to do any kind of disease control here. So they sponsored a lot of countries to start something like this. In fact, they sponsored India to start something called Integrated Disease Surveillance Program, which comes under National Health Mission, where I'm the director for the state. So in this Integrated Disease and Surveillance Program, throughout the year, people, our health workers who are called ASHA workers, they go door to door and they check whether someone has a fever. There's something called S form, F form, L forms. These are fever-linked forms where they check whether there is any kind of a sudden outbreak of a disease. So there is like in stock market, you see, there will be a curve saying that, okay, this is a natural trend of a stock market. If there's a sudden spike or a downward spike, it will show. So same thing like for the fever clinics also, we have a historical growth and within that it is there. These all systems are set up during these times. But however, all sudden, I mean, this is one of the, why I'm saying this as giving a background of these things, because some preparation helped us in dealing with this pandemic. Any disaster can be averted. You cannot avert an earthquake from happening. You cannot avert a tsunami from happening. You cannot avert even a cyclone or a storm from happening. But what you can do is the impact what it creates. So there is something called, there is a Richter scale of earthquake, right? Similarly, there is a scale to measure the damages, the intensity of the damages also. Richter scale can be 8 of earthquake. But the life loss need not be around, 10 lakh people, 15 lakh people dying. You can save with minimal life losses if your preparation is very good. So in terms of disease control, in terms of communicable diseases, in India, we had some kind of a system in place. Every district had an integrated disease surveillance program. Surveillance officer was there. One doctor was designated as a district surveillance officer. His or her job was only to see to that if there was any outbreak of any kind of this thing. So for example, in Tamil Nadu, if you're going to see dengue outbreak or etc. So these are the kind of surveillance officers who will see, okay, this is a dengue outbreak, this is a chikungunya outbreak, this is a malaria outbreak, and etc. And where do you control? How do we micromanage. If you see example in Kerala, many times you must have heard about the avian flu has come, and because of that, the lakhs of birds have been culled, lakhs of chickens have been culled, and etc. It is not that it comes directly somewhere. There is a team for that. There is a dedicated team for that who keep on measuring any kind of such new diseases or something as if it comes through, we have to be reported immediately, and immediately there has to be a solution. In fact, in Tamil Nadu, the dengue and chikungunya outbreak was quite successfully contained to a large extent, actually. Otherwise, it could have been much more severe. If you have been through in Tamil Nadu, you might know see, there were sanitation workers who used to come to every house and used to check whether you have any kind of open water drainages or waters and etc. to avoid from this. And even if one single chikungunya case was reported or dengue case was reported in from your house, from the hospital or laboratory, there is a sanitation worker who follows up, who comes and checks whether everything is okay or not okay, and find whether what are the precautions you should take and not take. That kind of a system which was there, some kind of a system was there where, so that we were able to at least manage the pandemic, manage in sense at least kind of come around with this idea of disease and etc. Otherwise, we had no clue about how to deal with pandemics, because we have not had an experience in dealing with pandemics. We are very clearly shown across the world countries who have dealt pandemics in recent past. Even countries like Ethiopia, which has done with Ebola, countries like Taiwan, who has dealt with SARS-CoV-1, countries like Mexico, who are done with swine flus, countries like China, which keeps on dealing, countries like Hong Kong, Japan, they who have had experience in dealing with this kind of outbreaks immediately knew what to do, immediately knew what are the first measures to make. In fact, if you all remember, I don't know how many of you have the kind of memory, if you can go back to media and check. Initially, WHO or even other, no one was recommending wearing of mask as a compulsory thing. This was in the month of April, May, when in Meghalaya we were already trying to produce masks at mass level and try to distribute it for free for public. Because that time there was still a debate: should everyone wear a mask? What is the advantage of wearing a mask? Not advantage of wearing a mask. But even before that got into full shape in Meghalaya, we had a medical expert committee group. This is the second lesson where you need to have always in terms of technical matters, you need to have a technical expert committee. We had a medical expert committee where members not only from government side, we had members, someone from John Hopkins University in USA, we had someone from who is working from Bill and Melinda Gates Foundation, who are working in public health specialists, who are basically not exactly government workers, but who are working around with the world with government systems. So we had public health experts. So we had them in the medical expert committees. So one of them said that, no, this is the only way, if everyone wears a mask, the chances of spread can be reduced by 70%. And then we took a call saying that let us make, even whatever WHO's recommendation is, let us go and ensure that everyone starts wearing a mask in public places or in rooms where people have gathered and etc. Now I'm not wearing a mask because I'm alone in my room. So there is no necessity for me to wear a mask, and I have proper ventilation here. But else we need to wear mask, and it has to be worn throughout the wherever in public spaces and etc., and to maintain some social distance as much as possible. So this is one more learning in the process. It's important that you need to have a dedicated think tank team to deal with a large disaster. Say disaster like a flood, you don't require exactly a think tank team. You know exactly what to do. These are the areas to be flooded, and these are the areas to be evacuated. These are the areas. In Chennai, I think Chennai is kind of staring at a flood situation now. So, but now the preparations would have already been done in terms of where are the low-lying areas. If we have to evacuate them, which schools you have to put them, or which are the higher-lying buildings, or where other infrastructure is there where we can put them, who will feed them, how many days we'll have to have, who will be conducting the medical camps, who will be conducting any kind of disease, outbreak situations, who will be taking care of the children, missing parents, who will be counting if someone is unfortunately loses their life, property, how do you assess? There is a complete system for that. So there is nothing to for a technical group to come and say. But if you're going to be looking at wildfire, say in India, we are generally not used to managing. I'll just need to take a call. Just 1 minute. Yeah. So this kind of flood situation, etc., we already have a playbook what to do and etc. We have this something like a wildfire. Then you will require some more technical experts other than the forest officials to actually address something like a wildfire situation. Wildfire situations depends, and chemical disasters. For that also we make preparations, but you need a technical expert group. Something similarly for pandemics, we also had set up a technical expert group for giving kind of a objective feedback on what we are doing first. So that is the lesson, important lesson we need to learn, saying that uh, you need to take feedbacks from people who are your most important critics. So that kind of feedback is important. You might not like it, but you should listen to them with an objective mindset, not kind of fighting their feedback, but to learn, saying that, okay, this is an important point what they're saying. We may not like the person, we may not like the way the feedback is given, but take the feedback importantly, because otherwise if there is no feedback loop mechanism, then there is no scope for improvement. This iterative approach is very, very important in terms of improving your situation, when dealing with a pandemic, something like new like this. And in this pandemic, third lesson, so first lesson was some kind of preparation is important. You have a system and you need to be prepared is important. Second lesson is to have an important expert committee or expert group who can give you some kind of objective feedback. And this objective feedback and iterative mechanism. This expert committee will be at state level, but at the same time, if you are very smart, we can create this kind of group at the state level also, at the district level also. So once you have that kind of a mechanism, it's very easy and very nice. Very your implementation mechanism will become very, very effective and very efficient. Most important, two other things would be not to panic in a pandemic. It's very, very important, because the moment you panic, then you're not responding to a situation, you'll be only reacting to a situation. And panic is even worse than reaction. You will not even be reacting, you will be just throwing things like almost like fire tending. That's not going to help in a pandemic situation at all. So you need to see to that you respond to a situation and one by one matter, and lay out the pandemic in such a way with whatever information we have, in such a way that you can go block by block and you can address one by one other. So this panic situation should be avoided. And I think MSW, we don't have something like project management, but something like a project management would be very, very interesting in this kind of situation. So, okay, this is the pandemic and this is the one by thing and we have to handle, so that at least you don't panic. Your plan may not go by as it is, your plan may not be executed as it's planned for, but you are at least having some kind of a hold on to the situation. Most other important, again, fourth point I would say, suggest here is, see, when pandemic came, we had a long discussions, midnight discussions about how to deal with this, how to have, where to control, etc. We also were not sure about where do you draw the lines and etc. But one thing we discussed, thanks to my senior officer also, is very, very community oriented. We were thinking that, okay, there is a pandemic, it's a situation, but also look into it as an opportunity situation, not only as a crisis. Look also into an opportunity. What are the things, important things which we can do during the situation? Okay, pandemic has come. Are we going to make our community stronger in dealing with this pandemic? Or are we going to make it more, paranoid about this kind of situations when they come in future? Or how are we going to do? If you look into Tamil Nadu, particularly in Chennai, there is a temple called Plague Mariamman Temple. There are temples called, for every plague there is a temple. Mariamma, it's a particular deity meant only to deal with diseases, such kind of pandemic diseases. So it shows one thing: the deities have been set not as a matter of protection, but also as a matter of hope that we can overcome this. And many communities, humans have survived all this kind of viruses because they have been able to successfully overcome through learnings. Yes, there have been losses, there have been terrible losses in that mechanism, but they have been successfully been able to overcome it. So in this situation, where I work in a tribal community, here, how are we going to convey this pandemic to the public in such a situation, and where they can positively overcome their attitude in terms of dealing with situations, in terms of learning? If there is a crisis, we will deal with the crisis, but are we going to deal in a way so that we can have a lot of learnings, positivity, and as well as good outcomes and measures? Or are we going to learn in a way that, okay, we will put strict lockdowns, we'll put everyone in house, we'll put everyone arrest, and we'll make so much of social policing? Are we going to deal like that? So we took the first route of educating people. Although tribal communities, small communities, village level communities they all of them like policing attitude. How are we going to change that policing attitude into policing responsibility? Not only into attitude of, I will decide where you stay, I will decide where you come. From there, how do you go? In the instance, Meghalaya probably is one of the first states in India where in the first protocol, which was issued as early as in 26th or 27th of March, where we made home isolation as an integral part of dealing with this COVID. In fact, when we had made a lot of feedback was that saying that how could you make like this? This is how can you deal with diseased person inside houses? But we had to explain to them there will be thousands of cases. When we told today, Meghalaya last 3-4 days we touched 10,000 cases. When we told there will be tens of thousands of cases, how will you deal with all those cases? You think we'll have enough hospitals to put all of them? No, we'll not have enough hospitals to put. We need to learn. And we have learned one thing about the disease is that many of them are mildly symptomatic or asymptomatic. So these people just have to be isolated for 10 days and the virus will automatically die down and they can resume their new duties back. So from then onwards, we have been insisting on home isolation. So for us to translate this institutional isolation into home isolation was a very easy affair because we had kind of seeded that idea from the beginning, although it was not taken initially because when there were very few cases, they were all sent to institutions. Once the cases started increasing in hundreds, people themselves did not want to come to institutions anymore. They were wanted to stay at home because home is the best place to take care and you have someone to take care and there are taking care protocol. See, I was affected by COVID. I was under home isolation. My people who are working with me at home and my wife, they used to keep food in disposable plates outside my room. I used to eat and I got recovered also. It's not a big deal in that manner. So we insisted that from the beginning. So we wanted to take, and community, we started something called community COVID management teams. There are more than 6,000, 10,000 community COVID management teams in Meghalaya. Every community has a COVID management team. So it is important that government informs them directly rather than they learn lot of things by misinformation. So this is one of the most critical part of the lessons which we had, not only learned, which we had implemented and we got a feedback. So we indulged with the community. We told them this is the virus, this is how it is to be dealt with, and now we need your support. And they gave support. They found out a common space. If someone at home is, does not have a space for home isolation, that person can be brought to a community COVID management team. They will be taken care of there. So those kind of interventions we had done, taking community along. That is one of the most important. In fact, top-down model is a very, very old model that we know about the virus. We will teach you and etc. No, we have to learn and co-learn. In fact, we learned a lot from the community. They gave some a lot of feedback. This is to be done like this. This is not to be done like this. You can't. They gave a very, very important feedback, and those feedbacks etc. we had put to use, and we kept on evolving. So this iteration model, which I mentioned, will work only if there is a feedback loop is open, and if the feedback comes, you implement a solution. Again, the solution gets a feedback. Again, you see whether the solution can be scaled up. So like that, we need to make along. And this community COVID management teams was also formed to strengthen decentralized decision making. So the state level, we were giving only broad protocols, and we had left a lot of things to be decided at the district level, block level, village level. We told them, this is as much as your problem, as much it is our problem, meaning like the state problem. It is all our problem. So we need to see to that you take your decisions at the ground, and so that you own up the responsibility of taking a decision. We have given the broad guidelines. For example, if a person is tested COVID, you cannot mingle with the person, or you cannot let the person open a room around. That's a broad guideline. Whether you want to isolate him at his home only, or do you want to bring you to your community hall and isolate them with separate toilets and etc., that is up to you. You decide on that. So once you give that kind of responsibility, then people will take that and they'll own it up. Now we are thinking of this mask situation, where how can we compulsorily make everyone to wear masks, otherwise the communities can actually fine them. There are small legal issues there, so which is there with our law department to find out whether it is possible for someone to fine it and take it like that. But only that is going to make us, in community, we learned that what is the very definition of community is to have something called that we feeling. When you say we feeling, so if someone is not following and someone is following something, there is a norms, societal norms automatically comes into place. then rules are not required. Norms will say that, you have to dress decently in a society, you have to dress decently in a village, you have to behave decently, you have to speak decently in a village. It's a very, no one is not a laid out rule, it's only a norm. So like that, these things will become a norm once you decentralize up to that level. And finally, I'll just stop with this final word so that we can open it for Q&A. This was a very data-driven pandemic. Technology came in big time handy. In fact, I mean, maybe all of you can go and visit our website called meghealth.in, 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 where we have all data according to where people are stationed, how many of them are in which corona care centers, some of institutions we have, how many tests are being conducted, district-wise details, everyday details, how many cases, everything is there. So, and everything is there and open, but the background work is quite tedious. It takes many tens of hundreds of people to gather this data and put it in such a nice way where 1 + 1 will be equals to 2, and it will not be equal to 4 or 5 or something. So data should add up. So that data-driven pandemic, this was a big situation, opportunity for us to deal a pandemic in fully data-driven manner, so that we will be able to know exactly where are the pockets of zones of high cases, and where are we should take precautions, and etc. etc. At the state level, we'll be able to see all those things. This districts also can see, and the portal is open for everyone, so anyone can go and see. Even Odisha government has a very good portal. Every state has developed a portal for this, for all kind of information, because this is a very, very data-driven pandemic, or a pandemic which was managed by data. Where pandemic decisions, interventions were taken by data-driven decisions were taken. So that was very, very important, time for us into dealing with this thing, and it gave a lot of lessons how we can actually efficiently manage even such a large pandemic through efficient in a very data efficient manner. So just to sum up, first is to see to that you have some kind of preparation for a disaster. When I talk about disaster, you need to figure out all kind of disasters. Even in Disaster Management Act, we kind of had about diseases, but not this much of a pandemic kind of a disease. One. Second, you should see to that you don't panic, and there is always a plan, and don't panic. And third is important that you have some kind of an expert committee to give an objective feedback in managing of a situation. Governments, basically many of them can get arrogant, and they will not take any feedback. They know that what we are doing is correct, and they will not take any objective feedback. That becomes a problem later. So from beginning itself, you need to put a mechanism to see to that there is an objective feedback. Fourth is taking community. In fact, indulging with community extensively is very, very, very important. That's something, otherwise communities will not learn to overcome this, and communities will become more backward. In fact, this you will start seeing in next 1 or 2 years, how COVID has actually impacted our culture, social culture. It will be a great lesson to study. Many of our our behaviors, our belief systems comes from diseases. If you go into all those things, I don't have much, there's not much time I can tell. I just like mentioned, like deities like Mariamman, etc. The very idea of these gods and etc. are all disease prevention gods, and these gods are existent throughout the world until big religions came and took over. These gods existed across the world, even in most tribal societies. There are gods which are disease prevention, and because of that, there is for example, I think in Kerala, many villages are there where if you have gone for a fisherman, if you go and come for 5, even today, I think in many places, 5 to 7 days, they don't let you inside the house. They make you stay somewhere else because there is a fear that you might carry a disease. These all might be thought as very redundant or old-fashioned things, but these are all behaviors which has come because of such diseases. And probably our Indian tradition of folding the hands and saying namaste, vanakkam, or namaskaram, whatever it is, could have come because because of this handshake would have brought disease. Today we are again taking back. Today you will see this handshake going to take a long time to come back again to normal practices. These are small dressing. Now there are dresses, shirts, everything which has come with masks attached to it. So a lot of these things also will change. And if these change, whether these changes are going to happen for positive things or whether it is going to happen in a negative manner, it depends on how communities are actively engaged in dealing with this. The last thing is how data-driven the entire system is, and that is how it's going to be in the future also. This is not going to change because we have enough technology today now to in a very distinct technology, cheap technology, simple technology, efficient technology to deal with situations like this. And the last but not least, one point I forgot to mention is documentation. That's a very, very important thing. We are very, very bad in documentation, but this pandemic, at least some things are happening. We have an entire documentation team here to document all kind of works and things happening so that the next pandemic, when it hits us, we are better prepared. So I will stop here, I guess. So we can take any questions on this topic or any other topic which anyone would like to ask.
We thank you so much for the enlightened session, sir. Next, we will go with the question and answer session. Participants, please post your questions in the chat box. Sir, actually, personally, I have one question. The Meghalaya government, before this pandemic starts, there are some rivals are going on. They are under the lockdown for so many days before this pandemic itself. So, do you think, sir, that makes the job more easier for you to make the people to stay inside the home during the pandemic?
Are you referring to the NRC and CA this thing problem?
Yeah, yes, sir. Actually,
no. We did not have.
They had so much of lockdown.
No. I don't know. No, not much actually. Those lockdowns were there hardly for, I don't know, Meghalaya. Assam had some days, 4 or 5 days or something like that. But curfew in Meghalaya, daytime curfew was not so much at all. I think daytimes are all okay, fine. Night curfews were there, but daytime curfews were not so prevalent. Although this kind of one analysis came saying that because of the previous CAA and RC issues, a lot of people from outside had not come during that time, and that's why one of the reasons why cases were low. That is not a very well-founded fact when we look back today, because Assam had lakhs of cases, Manipur has had thousands of cases. We have touched. Meghalaya has still remained one of the lowest cases since the beginning. We have remained as a state lowest number of cases per million population. We have 3.5 million population. We have only 10,000 cases. And even in comparison, we are one of the lowest states from the beginning. But making people stay at home is not easy at all. I mean, who wants to stay at home for so long? Although like to give, but for long we cannot have stayed so long.
Yeah, yes, sir. But actually, when I see from the other state people, the Meghalaya people are so good at by obeying the rules. So
Sorry,
I think so. That is not make the Meghalaya people who are in the Meghalaya people than the other state people. They obey the rules of the government much other than anyone.
Yeah, so no, that's because we take community along. There are here in tribal levels, there are communities in, say, for example, Kasi Jain, there's something called Darbar Shnongs, and we take them along. We tell them what is this and how the things has to be engaged and how they have to play a very important role. They take an active participation, and when it becomes a community-led norms, then people don't defy that easily. Community-led norms are very, very strong. They are most times stronger than laws itself. In a country like India, particularly. Even in USA, I had been last day in USA. There also communities are very strong. In fact, was there in USA last year. I had taken an appointment to meet with the mayor of Pittsburgh, Mr. Bill Peduto. In fact, we were having a very long conversation, more than an hour and a half. I was asking, what did you think is a secret for building of this beautiful country, an amazing country like the United States? He said community. That was the very important reason. On every many of them were, the particular Pittsburgh is a very Catholic area. He himself is a Catholic, and a lot of Sunday churches, Sunday community works was important. The non-Catholics, the non-Christians, they also had a community participation. This taking along community was an important, very integral part in building Europe and US. And we are all, in fact, that is how they became from norm-led society to a law-led society. So we are in the transition period, and we also should see to that we reach there in a peaceful and a quick manner. So it's basically community norms. It's not about people willing to defy and etc. It was much more led by community. Nothing other than that.
Okay, sir. Sir, here in chat box, I have few more questions. I'll just read out those questions, sir.
Yes.
How
Yes.
state and local governments practiced social distancing during preliminary damage assessments?
How do we practice social distancing in
Yeah, during the
where?
preliminary damage assessments.
In government offices or outside the offices?
By the governments, by what are the steps took by the government, sir, for that?
So the first thing was, of course, social distancing was tried to be achieved immediately. Government had taken, because the union government also did not know much. No one had any much clue whether what to do exactly. So all the governments went into lockdown. So they said no movement, absolutely only essentials movement, and otherwise you have shut it everything. Shutting down something is very easy. Opening something is very difficult. I mean, people also it takes some time to open up. So lockdown was one thing where you could maintain social distance. People are not gathering anywhere. Closing down the public. These are very easy measures. These are very temporary and easy measures to do. Long-term measures were like in, say, for example, government offices, we had introduced a lot of online meetings like this. So they not come to office. People who can work online can work online. Were used to can sign files. Reduction of number of people who are working in government from 50 or 100% to 50% on rotation basis and etc. These were things which were used to bring social distance so that people have enough distance and etc. And more than social distance, what is important is wearing mask and having your environment a ventilated environment, not a very air conditioned environment. These two are very important because social distancing is a luxury. It's not that easy for particularly a country like India, where we are very heavily and densely populated. Social distancing is not that easy at all, anywhere, because including your airports, railway stations are all designed in such a way that in 1 meter, in 100 meters, more than 100 people can stand in a queue. Suddenly you say 1 and 2 meters only you can stand, your entire thing comes to a standstill. So that's why sanitizing, wearing mask, and being in a ventilated space becomes more important.
Okay, sir. And one more question from Rajini. How was the social culture changed during the pandemic, and how do you think it will affect the pandemic gets over? What did what sorry would it remain the same or become the progressive or recursive in some ways?
Yeah. Okay. So as I said, Rajini himself or herself, I don't know whether of them. It looks like Rajinikanth himself coming to politics has been delayed or postponed or cancelled because of COVID pandemic. Those are, I mean, jokes apart. So those are the kind of changes which you will actually see. As I said, belief systems will change. People now are, which is very good, is thinking about smaller gatherings, smaller weddings, restricted parties, and etc. So when you look into post-COVID scenario, you have to look at social, economical, and even political. So social will become like, people will think twice about meeting strangers and meeting new things, and they might critical about travelers, particularly coming from outside. You'll be okay with someone letting your neighbor coming to your house, but if your neighbor has a visitor from China or from Europe, then suddenly you will have doubts about letting your neighbor inside the house. These things will change. As I said, handshaking will change, body language will change, mentality will change a bit. But these all again depends on do we have an effective treatment mechanism. So now what has happened, basically why people are not that serious about COVID is because people are also smart. They understand that out of 10 people, 9 people survive, or it just comes over, they come over easily. Only 1%, the general mortality is less than that in India. So that people can survive, and medical hospitals and etc. all have kind of standardized the treatment protocols. What is the first thing to give? Your early hospitalization most likely saved. Not that much of a killer if you're hospitalized or deadly of the disease. And about vaccines also. So we have 3 good candidates for vaccines. I mean, if you discount the Russian vaccine, there are 2 good candidates. Pfizer is having one, Moderna is having one. Even if you discount Pfizer, Moderna's look cheap and they look easy logistics and they look very, very promising. So we don't know if the vaccine comes, say, by January, February, and entire world is getting vaccinated within the end of the next year, which is quite a Herculean task. It's not that easy. By 2022, we might be seeing, we may not remember how much of this pandemic, so we might go as business as usual itself. So we have to wait and see. But previous pandemics, previous outbreaks has had social changes. Those are the social changes. We need to keep it as baseline changes and to quite keenly observe what are the changes which are happening now. And anyway, as I said, as simple as said, no one is shaking hands anymore. So that itself is stopped. And people participating in number of events has come down. People going out for tours has come down. Economically, people spending pattern has changed drastically in India. People are not buying things which they will normally buy before pandemic, and their buying pattern has changed. So we have to wait. This is still 6, 7 months, 8 months is still not enough data to say everything. We need another 6, 7 months more data. Maybe if we have the same thing by next April, May, we will be able to tell a lot. And regressive, progressive, yes, as I mentioned, that is how we are going to take this is going to be important. As a community and society, as a government, how we are going to lead this into progressive changes. Say if marriages are going to become less expensive, less burden on the parents who are sponsoring those marriages, it's probably a good thing. I think most of us will agree. Having lavish parties and etc. probably are not the wisest way of spending one's money. So those are probably nice things. If those continue, great. But we need to see how quickly we're going to reverse our behavior. That also is something to see.
Yeah, okay, sir. And one more question is from Andrew. Speaking about a flood situation in the urban location like Chennai, where there are a lot of slum, many people might come into the homeless and put into the schools and other community shelters where it will be crowded. Do you think that that will be the outbreak of the second wave of COVID? How do you think the situation might be handled in the sense of social distancing where it would be possible?
So as I said, see, when plans are made as we speak, I'm sure my own friends and batchmates are there in Chennai Corporation. They will be factoring in all these matters. They will see to that, some kind of COVID testing is done in these camps itself. So the moment 100 people come, the next day you will see COVID testing will be done, and for all those people, who put in the camps, all the 100 people, the COVID testing will be done. And immediately, the moment you find out someone is positive, then you start immediately isolating others and keeping others, and that kind of plans will be made. Social distancing, as I said, again, it's a luxury. We all need to go into the habit of wearing masks, using sanitizers, avoiding social gatherings. That is a very, very important thing. That's the only way you can do social distancing. In India, it is not it's quite a luxury to have social distancing. By concept itself is luxurious, and by concept itself is very European and Western world, where a lot of space, less dense population was there. Here it is not that a possibility. We don't have that kind of infrastructure. We don't have those things to do here. And if you focus too much of social distancing, you will forget other things which has to be done. And you will forget, if all of us wear masks, maintain even 1 feet distance from each other, don't touch as much as possible, and use sanitizers and etc. as much as possible, and maintain some kind of personal hygiene. Most of these diseases will not survive long. Of course, COVID is slightly different because it can survive through droplets. It can survive through suspended particles for some time. It can survive as formites in your tables and furnitures, etc. What kind of tables take that kind of thing? Somehow we have designed a lot of things where a lot of glasses are there. Glasses can have more, continue more if it can. In places like wood deformites can stay for 40 minutes or 1 hour. Glasses can continue for 4 hours, 5 hours, 6 hours. So it depends. So we can't change all those things. We have to adapt and to see to that, testing is done, tracking is done, treatment is done early, mask wearing is done, hand sanitizing is done. Other than social distancing, if it is not possible, you need to focus on the other things. But yes, potentially this festival season, the flood season, the flu season, this could all lead to a very complicated situation. Thankfully, we have not seen now, because post Puja festival, which is very, very important in many parts of North India, Northeast India, we have not seen the kind of an outbreak which we expected to see. So it is already good 3-4 weeks post the Puja festival. So far we have not seen, but we'll have to wait and watch for the post Diwali issues, post flu issues. So till Jan, February, March, if we are okay with this kind of numbers, most likely we must have been okay with COVID, I guess.
Sir, thank you. So, and one more question, sir. What role technologies like drones and 3D imaging played in disaster management efforts during the COVID-19?
3D imaging is not going to do much. In Meghalaya, we were thinking of using drones to actually initially see about wearing masks and everything. You can easily monitor that. But for pandemic situations, drones or 3D imaging is not used that extensively. You might see here and there one news article just for fancy reasons one might put. When I'm saying technology, a technology which is to be used continuously and also giving kind of a long-term intervention. But that I don't think so is happening in terms of drones for particular this purpose. But in terms of other disasters, flood situations, earthquake situations, and wildfire situations, every other disaster, drones can be used extensively to take work. Has had is just too stunning. You don't need a drone from government. You can buy these drones on yourself and actually go and do a lot of yeah. So in those kind of drone situations are to be very well used. I myself own a good drone, and in fact, in the district where I used to work previously, there was a small flood situation. All the perspective, how many camps are there, how many where people have been established, etc. It can reduce your time very, very swiftly, and you can decision making can be very, very specific, objective, and very quick. That's going to save a lot of lives. So other than that, other than pandemic situation, because there most of the people are indoors. They don't want to come outdoors. They're not technically they're not outdoors, and there is not much you're not able to see the virus or something, and so it's not used. But in other situations, yes, a lot. We ourselves have used, and every place in crowd management is being used. Big events is being used. Security wise, it's being used. 10 years from now, you will see these drones probably flying across your city all the time regularly. Can fix fines. They can immediately see people who are going around without these things. It can get into your what do you call Aadhaar? I mean, either the Aadhaar number or to your license registrations numbers, and it can actually send fines to your home. What CCTV cameras and police people are doing together, drones can do it independently. 5 to 10 years time, we will see a revolution. And already we are seeing a revolution, but we will see a revolution in how the drones are being used. If you go to harbors today, it is being used to see containers which are getting. They just let the drones go. It automatically goes, makes a lap, comes and charges again. It keeps again going in on the rotation. Patrolling duty basically it does.
Okay, sir. Actually, I have one more question from Shreya. When the lockdown was imposed, people were afraid that it was a serious about the matter, but when it was eased, people were like everything is normal. And most of the people have the feeling that whatever happens, the virus will not affect them. And in a way that the ignorance. So, this.
So what? Last I could
She's
not hear.
saying that the people
So,
are taking it as so easy. And so, what is your view on this?
Whatever pandemics come, whatever information you give, whatever education you give, some people are not going to learn. They have to learn by hard ways. So that's the only reason we can say that. So just because some people are cannot lockdown, it was a very temporary solution just to prepare ourselves to begin the battle. Other than that, if someone chooses to be ignorant, if someone chooses to be stupid, if someone chooses to be not following rules because they think that nothing will affect me and I am special, I am unique, I am God-given child or something, it's up to them and their family members. Good luck to them. We can't do anything else. Because you can use an epidemic act. There's an 1896 epidemic act is there, and you can jail them. But how many will you jail? Our jails also not filled in there. The jails are already filled with a lot of other people. How many idiots can we jail? And we don't have a special jail for idiots. And if you do that, it will be a big jail, I guess, isn't it?
Definitely, sir.
Yeah.
And one more question from Suraj. Sir, can we consider acts like the Epidemic Disease Act in 1897 helps the government in early phase of COVID?
Yeah. Even today it helps. A lot of our lot of the legal provisions which we take in terms of lockdown, putting someone in, even I think even fining people for wearing not wearing a mask, etc. You can take it from there and put it into IPC and then use it. So IPC is Indian Penal Code. Even initial days, I think even Tamil Nadu, if I'm not wrong, even in May, June, I think they had jailed around more than 1,000 people for violating some kind of lockdowns and etc. and all under Epidemic Disease Act. And this is one way in June. But see, these are all there to tell how serious government is. That's all. People's participation, active participation in being a good citizen is extremely important. That somewhere is missing in our country a lot. Many places. If people are not going to take individual responsibility, no one can help you unless one can help themselves. Even God cannot help. Even someone believes in God and the theory and etc. No one can help you. So people have to take active interest in protecting themselves and being a responsible citizen. That is where as I said, the word preparation comes. The talking about education comes. Preparation means not that, okay, we are ready with boards, we are ready with a raft, we are ready with schools, we are ready with provisions to give for people who are going to flooded. No, not only that. You have to educate people to help oneself and help each other. Only in a city like Chennai, when flood came, people helped each other. People helped in big time. So that kind of education helps. That is the kind of education we need to tell each other. You have to be a responsible citizen for yourself and for others. Only that. When I say preparation, this also includes in the preparation. Education about disasters and disaster management and being nice to each other is a very, very important part of preparation.
Okay, sir. And again, one more question from Shreya. There is a saying that everyone should be prepared for anything. So how we can be prepared for the situation like this?
So to point I'm saying about everyone should be prepared for anything is that everyone should be prepared mentally that any disasters can happen anytime. So, but the impact of a disaster, there is something called, I think the two words. One is the intensity of the disaster and the impact of the disaster. The intensity of the disaster can be very, very severe, but the impact need not be severe on us. If you know how to prepare, if you know how to learn. So, for example, take a country like, everyone takes this country. I'm also taking the same country like Japan. They are prepared for earthquakes, from their building construction to the tables they choose to the trainings they do. Everything they are prepared for a tsunami and disaster. And so that's why even that kind of a disaster does not shake them up much. Because although the intensity of the disaster is very, very high, the impact is an intensity. So in that sense, we should be ready. We can't have like attitude like this, nothing, no virus can affect me because I'm, special, etc., etc. That are the basic things which, once you understand that you are also equally vulnerable like anyone else, just because I'm mission of National Health Mission or Joint Secretary in Health, doesn't mean COVID is not going to come to me. How will COVID know that, whether who is who? I was affected. Quite a people, around 20 people in my office were, all down with COVID. In fact, I had very severe symptoms. I was hospitalized for 4 days. Initially, I was quite symptomatic, but despite after home isolation, then for 3-4 days, I had to hospitalize for some medication purposes. So it was going to come very well. You can't think that you're special. That's something fundamental. And you need to see to that you have enough preparations in terms of, if you can't do any kind of physical preparation, at least mentally you should be prepared. That's what we are saying. And only then you will save money. Only then you will save for a rainy day. Otherwise, you're not going to do those things. So those are the things I'm talking about preparation. Individual level preparation. Otherwise, government level preparation is much different.
Okay, sir. And this is my question, sir. So during our school days, we had chikungunya, swine flu. Likewise, we also have some flus and disease at that time. Do you think that this COVID-19 was exaggerated more than the other flus that we got affected?
No, not exactly. See, chikungunya, dengue, and etc. Number of people who got chikungunya, dengue, and number of the rate of spread is very, very low in comparison to COVID. One person COVID can potentially infect 400 other people with R not ranging from that. And the rate of transference from one person to another is very high in COVID. It is not that serious, probably not that serious a disease, even like chikungunya or dengue, where it has a very long lasting impact on people, young people, old people. COVID probably will not have for everyone as much as it, but the rate of transference so fast spreads from one to another, which chikungunya was not there in 190, 200 countries across the world at one single point of time. Dengue was not there at that point of time. But COVID is there in every single district of Tamil Nadu, probably every single village of Tamil Nadu as we speak, probably every single street as we speak, and probably it will be there in every single household in the next 4, 5, 6 months. We never had any kind of disease like that. So it was not that exaggerated. People kind of like to think that it is exaggerated. But when you look into the numbers across the world, as we speak, 100,000 cases are reported in US every day. More than almost 1,500, 2,000 people die every day there. Even in India, as we speak, 30,000 cases are reported every day. And I think close to 1,000 people are also dying, and all the number has come a little down. But there's a lot of deaths. So it is, we should not think that it is an exaggerated, but because something is new, our reaction seems to be little, on the higher side, but it is for the good only. I don't think so it's for the bad.
Okay, sir. And I have a few more questions. So can I go ahead, sir?
Yes. How much time do we have?
Till we have around 24 minutes, 20 minutes still we have.
Yeah, we'll take for 10, 15 minutes, then we'll wind up.
Okay,
Yeah?
sir. Sure, no
Yeah,
issues.
yeah.
Okay, sir. How was the public involved in the voluntary efforts to lessen the strain of the government?
As I said, we started something called community COVID management team. So every locality, every community in Meghalaya, every village used to have a community COVID management team. There used to be a school teacher. There used to be an ASHA worker. These are the village level health workers. And we had the Anganwadi workers. We had the community head who is there. There's a traditional community head who is there here. The traditional community head was part of the team. And these people were, having designating volunteers. They were identifying volunteers, young volunteers from within their team, and they were used. So as I said, we decentralized this process. We encouraged them to participate. Some money was given to this community COVID management team to do some kind of work, and here 5,000, 10,000 rupees was given of the Chief Minister's special grant. Through that, it was done. That is how we brought in volunteers. So we did not go directly house to house and check for volunteers. We engaged the community, and community in turn engaged the volunteers. And today we are engaging NGOs for behavior change management. This is something Meghalaya has uniquely started in the month of June. We thought, vaccines might take some time. By the time we need to change our behaviors. So we heavily invested on behavior change management. In fact, if you go to Android application, you have an app called Behavior Change Management, Behavior Change Management Training app. In that, it was developed from Meghalaya and with our NIC team here. You can see, and it's a very nicely designed. You have a checklist every day. What are the things? Like a checklist. Okay, have I done this? Have I done this? Have I not done this? Etc. Etc. With that, there is a score mechanism. In that score, you'll know whether I'm in a proper behavior or not. So through that, we train behavior. We are engaging with NGOs to train hawkers, train auto drivers, train village level people. We train different people. So that is the kind of investment we are making to change the behavior of people. Unless, because adult learning is a very tedious process. Children, you tell once, they'll not repeat it. They'll follow it. It's very easy with children. But with the adults, they're always skeptical. Whether we kind of reacting is special. So that's why you have to keep on training, retraining, reiterating. Otherwise, it's going to be very difficult. Even like in India, operation this was last time was AIDS control. So in AIDS control, even when I was in MSW and etc., when we are going for NGOs, our internship with NGOs and etc., that's what we call, right? Yeah, so concurrent fieldwork, etc. We still had, this is in the year 2009, 8, 9, where we still had NGOs who were dealing with how to use, contraceptives for both women contraceptives or male contraceptives to avoid AIDS and etc. in areas with those things. So, and that work was still going on, where we were thinking that, okay, people are kind of aware about AIDS, but it's still going on. So it was a long 10-year exercise and still going on for 2015, 16. Only now we have come to a situation where the behavior has changed. Use contraceptives, and using contraceptives is a very, very integral part and very important part. And that cultural thing has been a little overcome because of all these things. This taboo has been overcome. It's taken a long time. So we are using volunteers and NGOs to do this kind of exercise of behavior change management as of now through this system of something called community COVID management teams. We have more than documented teams of, we have more than around 20,000 teams we have state.
Okay, sir. And then how were effective disaster preparation exercise conducted with the neighboring states?
Generally, disaster preparation is within the state exercise. There is not much, but we had some learnings, etc. We share, but sharing between the states is done with the help of National Disaster Management Agency. NDMA will come into help into saying the learning from one state to another state. They are the ones who are. Otherwise, states operate separately, and disaster management is entirely a state subject. So states are the ones who are doing it. And learning sharing between the states is the decisions about the two states, whether we can do it or not, and etc. In Meghalaya and Assam, we had learning between COVID experiences. We had done in the month of May, June. We had done 2 rounds of sharing of learnings, and Government of India organizes a lot of programs where we share these learnings.
Okay, sir. Sir, and one more question. Since there is a back-to-back disaster happening like a flood, cyclone, now it is a pandemic, how it will affect the mental health of the people?
I think that it will affect mental health. The moment it hits your economy, it will affect everything. Once a household income goes down, you will have all kind of issues which are coming. People will become more, conservative in terms of expenses. People will become more, safe-minded. They will not be they'll not spend here and there. And people will feel that, most importantly, people might feel that I am not in charge of my life anymore. Things like pandemic, flood can affect my life. So therefore, if I'm not in charge of my life anymore, I have to be always dependent on someone. That feeling might come. That's the most important and terrifying feeling. I don't know how many of you have had to realize that in your life anytime. When you had a fracture, we could not move. When you had bedridden for fever or something, you had to help for everything, and you will feel very terrible that for every small thing I have to ask for someone for help, and that's a very terrible feeling. Once people feel that, one disaster after another disaster is coming and my life is not going to be there, I'm not in charge of my life anymore, then they will start becoming very dependent on the government and other systems. That is a very bad situation. Could become, but again, as I said, it's about people, how people decide to react to a situation. Until they decide to react saying that, okay, no, I will be a better person, I'll take charge of my life, disaster might come and go, but we will keep our earnings and going. It's again coming up to that individual and societal attitude.
Okay, sir. Thank you. Sir, one last and final question from my end.
Thank you.
Till now, so the Meghalaya government was so conservative to let in the people from the other states, even from the northeast state like Assam or Manipur. You're restricting the people so much into the Meghalaya. Even the central government has given the approval that people can travel and do those stuffs. So what is the reason that take this step to stop the people to getting into the Meghalaya for the unnecessary things?
So actually, it's actually a myth that Meghalaya is restricting. There is no restriction like that. If you want to travel, you can. The only thing what we are Meghalaya is saying that is that before you travel, please register with us before you're traveling into the state, because we would like to know whether you have been tested with COVID before, or are you going to come here without testing. If you're coming without testing, then we will do the testing at the entry point. So we are just asking for registration for testing only. That's all. We are not about restricting. In fact, Meghalaya is a very important transit state. Transit state meaning Assam is here, Meghalaya is here, and the other northeastern states, Tripura, Manipur, Mizoram, are all here. So from any vehicle coming from Assam have to pass through Meghalaya to reach quite a bit of Assam itself. There is an Assam, there's another area called Kachar area of Assam where a huge population is there. So Silchar areas, Tripura, Mizoram, quite a little bit of Manipur, also not much, but with these states are all the materials, milk, from everything has to pass through Meghalaya, and they have to reach petrol, diesel, LPG, milk, car, vehicle, all of they are important transit route. It's a very important highway. It's Asian Highway 1 is also there in that level only. So there are no restrictions. They can keep continuously moving. In fact, since beginning of pandemic, we have seen to that is going very smoothly and without any difficulty for people. The only thing is that those who are coming into the state we are asking them to register for testing. They have to test and they have to come, because that's a state decision which has been taken that if you allow, if you are going to say people, we're not going to even check, people are not coming, but testing and all, it's a problem. The same process is there in Arunachal, the same process is there in Manipur, the same process is there in Nagaland, even Nagaland, and even in Mizoram, the same process is there. It's not that Meghalaya is the only state which is doing it. We are just asking for whether have you been tested in the last 3-4 days, and if you're not willing, just please get tested at the entry point. That's all.
Okay, sir. Thank you so much, sir. That was a very wonderful knowledge sharing session. I thank the speaker for clarifying all our doubts. Sir, can you please kindly give us the final remarks about this session?
Thanks for the opportunity, and that was a good time for me also to reflect on our works. Generally, we don't get much time to reflect because we are focusing on the work, doing the work. So this was a time for me to reflect also. So I'd like to thank Professor Dimin and I'm Shant. I'm sorry, I forgot Sudarshan and Professor Dimin for giving me this, getting this to be done. And thanks to if any of the professors have joined, and I'm very thankful for them also for having such kind of events which are happening. So that's all from my side. And if anyone else is there, my email ID is there with someone. You can post your questions through email also.
Thank you so much, sir. I now welcome Ms. Namrata Ajay from first year MSW to deliver the vote of thanks.
Thank you, Sharavanan. Good afternoon to all. I deem it a great honor to have been asked to propose a vote of thanks to all who have helped us in making this webinar a resounding success. I, on behalf of the PG Department of Social Work, Shift 2 and Pegasus Students Forum, extend a very heart of vote of thanks to our Honorable Chief Guest, Shri Ram Kumar S. IAS, who blessed us with his presence and took out valuable time of his busy schedule and helped in making this webinar interesting and insightful. It was indeed a very thought-provoking session. Thank you, Ram Kumar, sir. I would like to extend a special thanks to NIDM Coordinator, Ma'am, Dr. Ajinder Walia, for your constant support and cooperation. I express my gratitude to our beloved principal, Dr. S. Raja Samal, sir, for his presence, constant encouragement, and support. I would like to thank our HOD, PG Department of Social Work, Shift 2, Dr. C. Francis, for his moral support and guidance. My gratitude is also due to our webinar coordinators, Professor Damon Queen and Professor Priya Doris, and other faculty members of Shift 2 for backing us and making this webinar a great success. As no program can become successful with a single person, so I extend my big thanks to our Pegasus Forum members and all our volunteers for their support for making this event successful with their contribution. Last but not least, I thank you all, the wonderful students and participants for your valuable presence and active participation. Once again, I thank you all for your cordial cooperation. Thank you.
Thank you so much, Ms. Namrata Ajay. With this, we come to an end of the session. Participants, the feedback link is put on the chat box. Kindly fill in. We also have the next session coming up on 25th November 2020 on the topic of disaster risk reduction, communities' role, opportunities, and the challenges. Do join with us then. Thank you. Thank you so much. We will catch up you on the next session. Thank you so much, sir. The Zoom link will be kept open for next 10 minutes. Do fill the feedback link. Thank you so much, guys. Have a great day.